Very good morning, doctors. I think we came with one more MCQ. We'll just read. Just 1 minute. Yes. So a patient, I think this was the question. A patient was treated for OCD, obsessive compulsive disorder. Fine, that's okay. Now the patient reported with toxicity, means drug toxicity. The doctor observed the drug as clomipramine. I think, what is clomipramine? Can you tell me for which class it belongs to? TCI. It belongs to tricyclic antidepressants, TCA, right? Clomipramine. What are other TCAs? Can anyone tell? Tricyclic antidepressants, amitriptyline, nortriptyline, these all are tricyclic antidepressants, right? Now, your treatment for the toxicity is, now these type of questions most commonly you see in INICET. It looks a bit confusing. Why I will tell. If you know the drug for sure, if you know the antidote for sure, then obviously you can mark the answer. But if you don't know the drug for the toxicity of clomipramine, most of the times you will fetch the answer in between these two, that is either stop the drug or decrease the dose. Yes, sometimes these can be the answers, but still the examiner wants to know whether you know the treatment of choice for the toxicity or not, whether you know the treatment, which drug you should give for the clomipramine toxicity. Yes, your answer is right. It is give sodium bicarbonate. In case of clomipramine toxicity, you give sodium bicarbonate as the treatment. So without making any delay, we will get to know what is meant by an obsessive compulsive disorder. First, we will discuss the topic with treatment also. Okay, obsessive compulsive disorder. Just we will go through the topic all itself. Okay, so most of the times, what is the most common obsession people generally have? Do anyone know what is the most common obsession? Most common obsession is they have a fear for contamination or death. Yes, most of my friends, they fear that their shirts or pants get soil if they play cricket. So obviously they also have obsession for dirt. That is, whether they have a fear for contamination or germs. But what is the most common compulsion? See, compulsion is different from obsession. Both are two different scenarios. Most common compulsion is hand washing. Something you want to do, that is most common compulsion. Something you want to do again and again and again and again. It's a compulsion. Your mind compels you to do that one. Your mind compels you to do that one unnecessarily. Hand washing. It is the most common compulsion. Most common obsession. It's a type of fear. Even though you know actually it happens like this, but still your mind gets confused or a question like it. You just fear for it. It might happen like this, maybe. So most common obsession is fear for contamination or germs, right? Now some people have some other different things like ego dystonic. Those are called ego dystonic obsessions and compulsions. What is meant by ego dystonic obsessions and compulsions? Guys, listen this one. This is very important. It is one type of a repetitive. It's one type of a patient having repetitive unwanted thoughts and actions. Repetitive unwanted thoughts and actions. That is called as ego dystonic obsession or compulsion. Some of the people will have it. Now what is the treatment? We will just directly go to the treatment. Treatment is very simple. Pharmacotherapy. You just do 2 trails of SSRI. You just do 2 trails of SSRI. What is meant by SSRI? Selective serotonin reuptake inhibitors, right? If SSRI fails, what you will do? If SSRI fails, just wait. If SSRI fails, what you will do? You will give one more drug called clomipramine. You will give one more drug, another drug, not one more, another drug. What is clomipramine? It is a TCA, tricyclic antidepressants. If you ask me, sir, what are the other examples of tricyclic antidepressants? I am very much happy to tell you. Amitriptyline, nortriptyline, rizatriptyline, these all are examples of tricyclic antidepressants. Now you might get a question, sir, are there any side effects of clomipramine? Of course, there is a side effects of clomipramine also. It is called as TCA toxicity, tricyclic acid toxicity, tricyclic antidepressants toxicity. Sir, then what will we do in case of a TCA toxicity? It's very simple. TCA toxicity, what you will do? Treatment, you will just simply give sodium bicarbonate. Remember, for TCA toxicity, treatment is sodium bicarbonate. Okay, now this treatment is all about pharmacotherapy. It's related only drug therapy. What about behavioral therapy? Yes, you are right, you give behavioral therapy. What is that behavioral therapy? It's a type of strategy in which you will ask the patient to undergo something called exposure and response prevention. Can you tell me what is meant by exposure and response prevention? Can anyone tell me? It is the desensitization and habituations to high levels of stress and anxiety. This exposure and prevention is done in order to produce or in order to make the patient into a desensitized individual. Desensitization means the patient is no longer sensitive to that particular stimulus which is causing the obsession, or compulsion, whatever it is. You will just make the patient desensitive. He is no longer sensitive to that sort of obsession or compulsion. So that is called as exposure and response prevention. So you make the patient desensitization and habituation to high levels of, you remember this, high levels of stress and anxiety. So in simple terms, I will tell you what is meant by this exposure. For example, you love chocolate very much. So because of this you are eating so many chocolates. Your girlfriend is having no chocolates to eat. All the chocolates which your girlfriend is buying and keeping in her home, you are going to her home, you are having fun with her, and you are eating all the chocolates. So your girlfriend is crying. So she thought of what I should do to make this guy just leave the chocolates like hell. He should not eat any more chocolates. So what idea I should make? So she thought for so much of time, and she got an idea. One day she brought a ton of chocolates to you, and she kept those chocolates in front of you. She compelled you. She just hold your filt. She just compelled you to eat the chocolates as much as possible, as many as possible. At one point of time, after eating 10 or 15 chocolates or dairy milk silks, eating 10 or 15 dairy milk silks, you went to a point where you just became like, I don't want these chocolates anymore. I am fed up with these chocolates. I hate these chocolates. These chocolates taste like hell for me. So your girlfriend just make you habituated and simply made you to hate those chocolates. So it is same like that strategy, but in a reverse manner. So what we do is we make the patient exposed to the stimulus or factor which is leading to compulsion or absorption. So we will exposure in such a way that we will prevent the patient from responding to it, prevent the patient response against it. So we will prevent the response by exposing the patient more and more to the factor. So if you expose him, obviously the sensitivity decreases, so the patient is no longer sensitive. See, in simple words I will tell you one thing, guy. There is a man, or say something like there is a person of age 15 years, 20 years, and there is a person who is age of 50 years. If a 20 years person, if a 20 years boy, if he looks towards a girl, instantly he will get erection. Obviously, see, frankly speaking, instantly the 20 or 18 years boy, if he sees a nice girl, he will get erection. But a 40 years or a 50 years man, if he sees a girl, he will admire her beauty. He says that, wow, she is very beautiful. What if she is my wife once upon a time? Not now, because he is 50 or 40 years. So already his marriage has been finished. So will that 40 years or 50 years person will get erection instantaneously? He will get erection? No, he will not get. Why? He is already habituated with his wife. So he is no longer that much sensitive like a 20-year-old normal boy, because 20-year-old boy is not at that much sensitive, because he did not marry. So obviously when he sees a woman, when he sees a nice girl, obviously he gets a erection. So same like that. Okay, it is a thing like desensitization and habituation to a high level. So the strategy that we use, behavioral strategy that we use, exposure and response prevention in obsessive compulsive disorder. So the drug we use is two trials of SSRI, selective serotonin reuptake inhibitors. If it fails, we go for clomipramine, which is a tricyclic antidepressant. But if there is a clomipramine toxicity, we give sodium bicarbonate as the treatment. Thank you.